Okie dokie, good evening and welcome to the launch event of Our Health, Our Planet, what we believe to be the largest resource of its kind for climate communication in the UK, possibly globally. Firstly, thank you all for coming on what is apparently a very sunny Tuesday evening for most people across the UK. But it's really great to see so many people at the start of this journey, at the start where we've been able to make the work that's been going on by over 30 volunteers for the past 12 months. We've finally been able to make it public today, and for us that's a real achievement, and it's really exciting, and it's really great to see so many of you here. As I say, this resource, Our Health, Our Planet, many of you will have been able to see it already. It's been live, it's since early afternoon, it's been shared around social media, WhatsApp groups, and what this webinar is designed to do is really to give people a bit more information on the backstory about how it's been developed, give you an opportunity to hear from some of the collaborators and contributors to the webinar itself, and also hear from a pre-recorded lecture from Professor Hugh Montgomery, who unfortunately can't be with us this evening due to other commitments, but he's sent through a webinar that he is happy for us to present to you. Now, as I say, we've had around 30 volunteers, and crucially, we've had a number of organisations involved in supporting this project over the past 12 months. Organisations such as the UK Health Alliance on Climate Change, Greener Practice, Plant-Based Health Professionals UK, Green Health Wales, SEE Sustainability, Ecomedics, Real Zero, and many others who haven't yet voiced their support publicly by contributing their logo, but are certainly looking to do so once appropriate governance structures are supported. So without, I guess I just wanted to say at the start of this a little bit about where the origin story has come from for Our Health, Our Planet. Now, this was very much a chance encounter when this idea was born, and I was at a academic medical education conference, and I met someone called Dr. Teresa Martin, who is one of the co-authors on the medical school's curriculum for climate change, and she's been a great support, both morally and involved in the project throughout its development. And we noticed that there was a gap in the climate communication sphere, that the type of resources that were available were either extremely technical, extremely simple, or just quite long and not something that you could flick through in 30 seconds and just get an idea of what the climate health relationship is all about. And so we came up with the idea of Our Health, Our Planet, because we think there's 1.6 million health workers in the UK. There are 68 million people who use the health service in the UK, and there are 600 million patient interactions within the UK health services every year. Now, what if we could use those conversations to drive climate action in a really simple, accessible way? And that's where the idea of Our Health, Our Planet came from. And so here we are a year later, and here I am presenting to all of you. Now, I'm going to move on to allow Hugh to give a little presentation about what climate change actually is, the severity of the situation that we're in, and why climate action is really, really urgent. And I think this talk, as with many of Professor Hugh Montgomery's talks, should come with a little warning. A lot of the things and science and stats that he presents can be quite distressing. And if the talk is going to be about 15, 16 minutes long, it will go through the climate science as it stands currently and finish with the message of what we can do about it. And we can make a difference. We can really turn things around. And that's why we're all here today. But if it gets too distressing for you, then just pop the webinar on mute, go make yourself a nice cup of tea and come back in about 20 minutes or so. And just before Hugh gives a presentation, Hugh will be very sad, but also pleased to know that he wasn't the first choice of presenter this evening. And we reached out to one individual in particular to try and give a presentation. Unfortunately, he wasn't available, but he did write back to us. And I'm just going to read out the letter that he wrote to kindly decline the invitation this evening. And that's, "Dear Dr. Lee, thank you for your letter. The Doctors Association sounds a most important organisation, and I am very flattered by your suggestion that I might be involved with it in some way. I hope you will forgive me, however, if I do not take up the idea. I am now 98 years old and am doing my best to reduce my public responsibility. I do hope you all understand and wish you all the best. Yours sincerely, David Attenborough." So after that apology, we'll move on to our guest speaker of Professor Hugh Montgomery. And again, this comes with a little warning. It will last about 15 minutes. Feel free to drop back in at that time and drop in, or just pop yourself on mute. Pop the webinar on mute if it's a bit too distressing for you. Just found that we haven't been sharing the sound. Bear with us. Lucy, are you able to help just share the sound? It doesn't seem to be wanting to.
Yeah, I think if you try and share the screen again.
Yep.
And then just wait for it to come up a minute.
Apologies about this. We had got it working earlier. It's blocked out the share sound option for me. Can you make me a host?
Yeah, let me make you. Right, you're now the host.
Let me try it again.
I thought there was something actually when you shared it. I thought there was a sound thing to click on.
Yeah,
that
it's not. It's not letting me do it. Really sorry about this, guys. If we can't get it working in the next little while, then we will move on.
Can you just share it again though? Just share it, and then is there a? Just do it again and just see if it works. Can you see at the bottom of the screen? There's a sound.
Yeah, so it was it's making sound for me.
Is it?
It's not doing it for, and it's not giving me the option to share the sounds, and I don't know why.
So if you click on that icon at the bottom, or bottom right, second along, if you click on there, will that do anything? No.
No. Okay.
I don't understand why it's not allowing you to.
No.
Hang on.
We're getting a message from Cal saying the sound is clear. Can you hear that, Lucy? Can you hear?
I did hear a tiny, yeah, I heard a bit, and now it's gone again. But if people can hear it, then yeah, it's very quiet.
The person, but not you.
I
Okie
think
dokie. I don't think what Lucy.
oh,
What I'll do.
people are
What
saying
I'll,
it's crystal clear actually.
Lucy. What I'll do is I'll send it through to you briefly, and then we will go through. Um, we'll make it work this way. Um,
Is it in video format?
yeah, but it's not physically letting me share the screen.
Right, let me try.
Okay. Right, that's been sent through to you. Very sorry about this, guys. We had hoped to get this all sorted. Thank you for bearing with us.
Can you just do it again, actually? Matt, can you just do it again? I've just pressed something. Can you just try it again?
Yep. Starting share screen will stop other participants' computers stand share. Do you want to continue? Yes. Media player. Share. Can we hear you?
It's just so faint. Very, very faint.
Okay, I've got it. Bear with me. This will just take 1 minute, and if it doesn't work, then that's that. Lucy, can you make the other mats, the one with the red light? Can you make that post?
Yeah. I'll have to take you off host. I don't think I can have too many hosts. Hang on.
Okay. Let me try this.
I can't now get you off.
That's all right. I've got it, I think.
Climate change. I'm going to tell you as we expect the climate change immediately. Grab a service.
Where's
Do you want to send? Can't hear you now, Matt.
I've sent it through to you on email, I believe, just to
Right.
download. And if that doesn't work,
Yeah. Okay.
oh, what a pain. Okay. Sorry, guys, we're doing our best. And if Lucy can't share it, have you got it through, Lucy?
Yeah, I'm just downloading it quickly. So
Perfect.
right, let's try. Hang on.
We will have a plan B lined up.
Let me just
Um,
hang on.
with that,
I just saw it. Where was it?
okay, you were sharing just a moment ago. And yes, I thought IT was supposed to make life more straightforward as well, but it doesn't ever seem to.
It says it's unsupported file.
Um, Yep. Okay. What we will do, we will move on, and whilst Lucy's trying to sort this, I will give you a quick overview of the website, because at the end of the day, that's the most important thing, and that's the reason why we're here. Lucy, are you able to let me take over?
I have to stop sharing. Hang on. It's just
That's fine. And
it's going a bit.
Right. I've stolen the screen. Okay, so apologies about the technical issues. I'm not certain what's happened there. Eventbrite was causing us some trouble as well. And again, we're not certain exactly why it hasn't caused us trouble with previous events. But let me show you the main event and the main feature. This is the website. This is the overview of the website, and this is designed to be used by anyone that uses the health service or anyone that works in the health service. On the front page, what we have is we have the QR codes poster, which I'll talk a little bit more about in a minute, but that is going to be the key to where you guys can contribute and make this big difference to the climate health discourse. We also have this timeline going on. So scientists across the world came up with this concept called the climate clock. And the climate clock is a theoretical concept of how long we have to get our carbon emissions to net zero, i.e. the amount of emissions that we release equals the amount of emissions that we absorb, to keep global warming to 1.5 degrees on average. And we're about 4 years away from crossing that deadline and going well above 1.5 degrees. Then we have split up into healthcare professions and the general public and patients to make the website easier to sort of compare and just a signpost for the appropriate resource for the appropriate person. We also want to address some of the main. I've just been told that Lucy's computer has gone and crashed, so tech is having a really bad day. We also wanted to give an overview of what climate change is, because again, this is what's really important, and this is why we're in this webinar today. We need to make it really, really clear that climate change is a long-term weather pattern that occurs over decades or centuries, and it is caused by humans. We have caused this. We want to make it clear that the climate crisis is a health crisis. The health of the planet and the health of us are codependent. This is the concept of one health. And it's the idea that human health and that of the natural world are so intertwined that humans simply can't survive without a healthy ecosystem and a healthy biodiversity. It doesn't work the other way. The planet will keep going. The planet will move on, and species will continue to thrive as they have done for millions and millions of years. In what state and in what state humanity and civilization will be in that time, who knows? It's really uncertain territory. And then we want to make it clear about the highest impact actions that people can take. And these are things that aren't spoken about very often. They might be in climate advocacy circles, they might be sort of casually, but they aren't spoken about from an organizational perspective, saying to an individual, what is the single best thing that you can do to make a difference? What is the one thing that you can genuinely do that will slash your carbon footprint and send a message to all of the big players that we need to take stronger action on climate change? Is no one able to see my screen? Have I just been told that as well? Ellen can see the screen. Fine. We're all good. So the highest impact actions that people can take are to move your finances, are to move your investments, to move your pensions away from accounts that invest in fossil fuels. The others are to switch to a renewable energy supplier, to encourage that investment in renewable energy sources. And also not just to eat more fruit and vegetables and to encourage that, which is something that we've tried from a public health perspective for countless numbers of years, but we need to be actively eating less meat and dairy, and significantly so. The meat and dairy industry, if you were to squash up all of the animals in the world, all of the land mammals in the world into one great horrible meaty mushy ball, about 35% of that mush would be beef, about 35% of that mush would be humans, only 4% of that would be wild animals. And our intensive agriculture, our intensive animal farming has caused massive deforestation and driven livestock far into places that they really shouldn't be. And if we don't give nature the chance to recover, as I'm sure you're all aware, then we don't stand a chance. So that's why eating less meat and dairy is really, really important. And then eat it, and then more active and green travel, more pre-loved, and speaking out, talking to your MP, talking to people in power, to managers. Again, these are all things that people aren't told that will make a difference, but they really, really will. And then lastly, the biggest and most powerful thing is to start conversations and to spread the word. In Hugh's talk, if we manage to get it going, he talks about an R number. Now, an R number was very common in COVID times. Just a couple of years ago, it was commonly spoken about in the news, and people were on about getting the R number as low as possible to reduce the spread. When we're talking about climate change, we want to increase that R number. With COVID around, at the peak of COVID, there was maybe an R number of around 3. And within 10 cycles, so what that means is that for every one person who had the COVID virus, it passed on to 3 individuals. Over that process happening 10 times, around 90,000 people would be infected from that one individual. Now let's turn that around and talk about climate change. If we had an R number of just one person here who spoke to 3 individuals and asked them to talk to 3 individuals, then after 10 conversations, we've got a reach of 90,000. What if we were to go up to 7? If we had 7 conversations, because most people have 7 people that they're able to talk to, that people trust, that people will listen to. And if we were to reach 7 individuals each, and those 7 individuals were to reach 7 individuals, and so on, and we kept going, we would be having climate conversations with twice the world's population. And that just shows how powerful conversation is. And that's where we really hope that the power of Our Health, Our Planet comes into it. Now, many of you on the call will be healthcare professionals. So let's just run through a little bit of the features of the healthcare professionals section. So we've got the clinical specialties, we've got the healthcare professions, students and medical education, and communities. The clinical specialties are all basically following exactly the same format on exactly the same page. And this is where the bulk of the volunteer load has really come into its own force. We've had over 30 different volunteers contributing to the different pages, and we're ranging with different specialisms from anesthetics to care of the elderly, right the way down diabetes, gastroenterology, genitourinary medicine, nephrology, all the way down to vascular. And these are just the main specialties that we picked out that have the sort of biggest reach, we feel, at the moment. And there's certainly scope to continue to develop. You'll see the likes of rheumatology we're working on in the process, but this is very time consuming and takes a long time to get all of the data together. So let's just have a quick look at the vascular surgery department. This show the format of everyone is exactly the same. How is climate change affecting that specialty? In the case of vascular surgery, the author talks a lot about peripheral artery disease, the relationship with abdominal aortic aneurysms, and extreme weather events, and how that can lead to trauma and urgent amputations, etc., for vascular surgeons. Then the next most important thing is how that department is affecting climate change in the first place. And this is where we hope that healthcare individuals can start feeling a little bit empowered by this resource, because we know that we're talking about all of these sorts of negative sides of things, of where emissions are coming from, where all of the waste is generated, the likes of anesthetic gases, and the carbon calculations associated with different procedures. And we don't just want to give the problems, we want to give the solutions. And the solutions are out there. There's so many solutions, and it becomes really, really complex. So we've refined it to try and give you the highest impact solutions and the best resources that people can go to learn more about climate change and how it affects that specialty. And as we spoke about with conversations, talking about climate change in the workplace doesn't need to be a taboo anymore. It used to be. It used to be something that only the small minority of people who might be involved in some sort of local climate activism, they might be involved in an organization such as Greenpeace, there might be a lot of stereotypes associated with that. That's all gone. That's all changed. Climate change is now a really topical conversation in the healthcare profession, and you can talk to people about climate change without feeling, or without that pressure being exerted on you that it's not, that it is something uncomfortable that we shouldn't talk about because we're in a healthcare setting. As I've said, climate and health are completely intertwined. And so these are just a couple of ideas to talk to your colleagues about how you can accelerate climate action in your department, and with patients about how you can, how they can contribute to improve their health and improve the health of the planet. And we've tried to make it really simple with the highest impact actions for the department to take. Again, the top action in pretty much all of the pages is to embed climate change and healthcare sustainability into education and into governance. Because if we do that, then we have to talk about it. We don't have a choice in the matter. And then more conversations can happen, and then more action can happen. And this is how the snowball effect happens, that we end up with twice the world's population talking about climate change. So that's very much from a sort of clinical side of things, but the vast majority of the workforce in the NHS isn't doctors or sort of specific clinical practitioners. A lot of them are either allied healthcare professionals, or they work in non-clinical roles such as facilities, the managers, the execs, and the vast majority of the workforce actually are nurses, midwives, and healthcare assistants. And so they are crucial to this climate communication. And we've been very fortunate enough to have nursing colleagues and midwifery colleagues contribute to these pages. And these follow slightly different formats in each of them. But again, it's trying to make it really simple to the point that climate change is affecting this specialty, and this is how it is going to affect this specialty, this profession, and then how this profession is affecting climate change. The Royal College of Nursing has excellent resources, and again, discussion ideas and the highest impact actions for different professions to take. Lastly, we have a couple of pages for healthcare students and healthcare education in general. These are going to be the workforces that are faced with the brunt of the climate crisis. And we have tried to identify all the main communities for people to be able to get involved with from healthcare, for healthcare professionals as well. Over on the general public side of things, because we've got 68 million patients, that's the population of the UK. And so if we can get all of those on board, then we can make a really, really big difference. But to start with, we need to start with the basics. We need to start what climate change is, again, and why it's a health crisis. And when, again, I'll read off a couple of anecdotes from Professor Montgomery's talk, because I'm not certain if we've been able to get it active or not. The fossil fuel consumption is going up constantly in the UK and globally. And this has been going on in spite of all of the COP conferences, in spite of pledges to meet targets. Carbon emissions have been going up so much so that we're actually trapping so when carbon emissions are released, they act as a blanket around the globe. That traps in energy. And when there's more energy, there's more extreme weather events. Now, if we think about more carbon trapping more and more energy, then every second we're trapping the equivalent energy of 8 atomic bombs into our atmosphere. That is monumental, and that is why we're experiencing all of these dramatic weather events. That's why in Europe at the moment there's catastrophic flooding in Austria, in Poland. It's why we've had the wettest weather, the wettest year on record, and so much so that the flooding has taken out about 10% of the cropland in the UK. Because with more heat, the atmosphere is able to absorb more moisture, and then when the atmosphere is more damp, it's going to rain a lot more. So although we're experiencing a lot of rain, that likely means that elsewhere in the world, places are experiencing intense heat. And we've got records being broken consistently, and we are so close to breaching that 1.5 degrees target. This is why this is so important that we need to take every action that we can now. Pandemics and antimicrobial resistance are something that we're learning a lot more about, particularly from the COVID crisis. But again, as we encroach more and more on biodiversity and different species, we put more and more pressure on the hosts of these viruses, on the hosts of these pathogenic bacteria and pandemic type illnesses. And that is one of the theories as to why COVID happened in the first place. It originated from a foods market, we believe. But we also see other pandemics emerging that maybe aren't yet affecting humans, but are certainly to be concerned about. Bird flu, for instance, has been very topical in the UK and is likely due to the intensive poultry agriculture that we have globally. Pollution doesn't need that much saying about it, really. I mean, we've got water pollution everywhere in the UK with words that I could use that are very strong. And And air pollution is very topical as well, with the likes of ULEZ, and all of these come with health issues. Air pollution is likely to cause dementia, it causes lung cancer, it causes asthma. Water pollution, we've had infections where patients have been admitted into UK hospitals because of contaminated drinking water. And lastly, the big issue for the climate crisis, why it's a health crisis, is refugees. Much of the refugee crisis is actually going to be from internal displacement, the likes of coastal communities around the UK, such as Fishguard, but also in Wales, but also Cardiff, London, all of these big coastal cities that have great big rivers running through them. And as sea levels continue to rise, more and more of that will become inhabitable. So people then have to start moving inland. And all of those people have been displaced by climate change. So this is really key as to why we're now having to push so hard. We've known about climate change for the last 160 years, and we've known about the severity of it for the last 50 or 60 years. Now we're now 50, 60 years on, and we're into the end game. And this is why we really need to make a difference. And people don't have that connection yet. The vast majority of people don't have that connection that climate change is going to affect our health in the UK. And that's where we hope that this resource is going to become so powerful. We want to talk about how climate change is being affected by healthcare, because that's just as important and that can engage more people in discussion. And we want to address some of the big questions, like why should the UK act when other countries have much higher current emissions, and it doesn't take into account the historical emissions. We can make a real difference with the health sector, and we'll talk a little bit more about that just in the wrap-up. We also want to, from the public and patient side of things, give people more specific information about particularly mental health, but also for young people, for carers and parents, and for extreme weather events. So there is a bit of a resource that explains why climate change is causing these things and why it's going to affect human health again. And also all of these resources that I've been showing you are all evidence-based, and it's all signposting to other external resources that can give you that extra information. Our Health, Our Planet is just to give you an overview, just to get you introduced into this world and to begin to know where to start looking. And then once you start looking, then you get all of the extra information, all of the infographics that are provided by these other resources. And then very lastly, taking action. And we've tried to explain why various actions are taken, why they're so topical. Food is such a big topical thing in the UK, and often brings climate scientists into conflict with farmers and the farming community, and that's not conducive to anything. We need to be working together on this, because climate change affects farmers. Climate change destroys crops, kills livestock, and so that's why we're needing to have these evidence-based scientific discussions. So we've tried to, again, explain why meat and dairy is not good for the planet, why we need to cut down on how much meat and dairy we're consuming. It's something that's quite uncomfortable. It's something to many people, it's something that big organizations don't particularly want to address as such. If you look at a lot of the advice at the moment, it talks a lot about increasing your vegetable intake and not necessarily decreasing the meat intake. That has to come alongside eating more fruit and vegetables. The two go hand in hand, and I think Shireen in a moment will talk a little bit about the sort of the health benefits of a plant-based diet and why she's become involved in this campaign. And that's it in a nutshell. It's a really easy, navigable resource. Significant thanks has to go to AtomX, the web designers, who have also kindly donated their voluntary time to help produce this resource. The total budget, to be completely transparent, we've spent DAUK has spent as an organisation less than £250, which covers only the essential costs of the website domain and the hosting fees. And with also thanks to Chloe Hill Designs for this really striking poster where this is the thing that we want you to be able to take action with. And I'll talk a little bit about that at the end. I'll stop sharing my screen for the moment. And have we got any questions just on that? Otherwise, what we'll do, because of time, we'll move on to just have a chat with Shireen, Emma, and Mark. Lucy, have you picked up any questions from the webinar chat?
Can you hear me okay?
Yeah, I can hear you okay.
One issue is that the red zone banks are quite happy to bribe customers with higher interest rates. Is this...
Yes.
So if you're in a situation where you need that extra pound, it's not the easiest choice, or maybe the easiest choice to not be ethical.
Yes, and this is something that I think is really important to discuss. That there's no doubt that there is a cost of living crisis at the moment in the UK, and because of the way that finances work for individuals, sometimes the most environmentally friendly option isn't the most affordable option at the moment. And yes, a lot of the sort of key players have a lot of financial incentives because they have that capital that they can donate for you to be able to continue to use their services. And this is where the education part comes in. This is where we need to be talking about why those that can afford to move away from those institutions, move away towards more environmentally sustainable banks and energy suppliers. And it does, because we need, what I'd love to say is we need everyone to do this. The reality is we don't need everyone to do this, but we want everyone to do this. And we certainly need those that are able to be able to do this. If we get 10%, well, if we get 50% of the population making these changes, 40, 30, maybe even 20 or 10% of the population making these changes, and if the big financial banks have suddenly lost 10% of their customers and the ethical ones have suddenly gained all of those, then that's going to swing the balance. That's going to move the finance, and those big banks aren't going to want to lose that money. So every single person that moves, they're going to be aware of. I recently moved my energy supplier, and they sent a questionnaire afterwards saying, what was the reason that you left? On that questionnaire was it was a multiple choice, and one of the statements was, I wanted to move to a more sustainable supplier. Now that shows that these organizations are worried. That shows that they're already considering what options are available. And if we start this mass movement where we all drive away from these institutions that are contributing to fossil fuel consumption, then we can make a difference. And the reason I say that is because we already have made a difference. They're already concerned and they're already trying to reconsider their options. So what I think it would be good to do, because I've spoken for a little while, I've got 3 people who have very kindly joined this evening. They are Shireen, Emma, and Mark. All of them have been involved in the resource in some way during the sort of development process of it. And what I wanted to be able to do was just to give them an opportunity to talk a little bit about their involvement and what their background is and what they hope will come from the use of this resource. Because I think it's really important that you hear from some of the people that have contributed. So, Shireen, would you be happy to start? And I will just give you a little introduction. So Dr. Shireen Katham is a consultant hematologist and the director of plant-based health professionals. She is passionate about promoting sustainable healthcare through lifestyle medicine approaches. Over to yourself, Shireen.
Great, thanks very much. Can you guys hear me okay? All good? Fantastic. Well, thank you very much for the kind invitation to speak today and to collaborate on this wonderful project that will undoubtedly be an invaluable resource. So huge congratulations to every single person involved. My involvement has been very tiny, so thank you, Matt, for acknowledging it. I'm really here in my capacity as a passionate advocate for diet change and food system transition away from one that relies heavily on the production and consumption of animal source foods towards one that is more plant-based. My initial interest in this area really stemmed from a desire to serve my patients better, because despite my specialty of hematology, which seems to perhaps not necessarily feel like it's to do with lifestyle behaviors, my patients all have comorbidities that relate back to lifestyle behaviors. And this includes unhealthy diets, which are now the leading cause of chronic ill health globally and in the UK. And so I realized a while ago, probably a decade ago, that I could serve my patients better if I could counsel them on evidence-based lifestyle interventions to improve both physical and mental health. And at the same time, it took me a little bit of time, but I realized that actually championing lifestyle medicine approaches was also going to address our collective desire to meet sustainability goals, as it speaks to all 4 pillars of sustainable healthcare, which is embedded in prevention and patient empowerment, lower carbon alternatives, and lean pathways. So within this growing field of sustainable and preventative healthcare, it became apparent to me that diet change was the most challenging to address and hence often not prioritized by healthcare professionals. We're in a lucky position where what's good for our health is also good for the planet. A diet centered around healthy plant foods, that's fruits, vegetables, whole grains, beans, nuts, and seeds, can not only prevent chronic conditions, but can significantly reduce the impact of our diet on the environment. A plant-based diet has around 1/4 of the impact on the environment when compared to an omnivorous diet. And this is regardless of how these plant foods are produced and where they've traveled from. Yet we in the UK are in this crazy position where there's complete disconnect between our farming and food policies and our collective climate and health goals. We use, for example, 85% of farmland in the UK to raise animals for food. This is despite the fact that animal agriculture is responsible for more than 50% of food system greenhouse gas emissions, is the leading driver of biodiversity loss, contributes to significant amounts of land, water, and air pollution, is driving antibiotic resistance and creating infectious threats. At the same time, this leaves us with only 15% of land for growing fruits and vegetables, which means we're having to import most of these healthy foods, and then we continue to be a fiber deficient nation. So a shift to a plant-based food system would not only reduce greenhouse gas emissions, but it has the benefits of releasing around 75% of farmland back to nature and rapidly enabling carbon drawdown. And this way of eating with little or no animal source foods has significant benefits for some of our common chronic conditions, cardiovascular disease, type 2 diabetes, certain cancers, and for supporting a healthier weight. So that's really why I founded Plant-Based Health Professionals, to empower people like you and me to understand the evidence of adopting a healthy plant-based diet. And this can, of course, be done in an inclusive and culturally appropriate way, and actually has the potential for financial benefits for the individual, the health service, and wider society, thus serving to address health inequalities. So I'm delighted that this new website and resource provides clear guidance on the need to move away from an animal-based diet and links to our website, which we have spent the last 6 years populating with resources that will make it easy for you, your families, communities, and patients to adopt a plant-based diet. So please do click through on the website through to our fact sheets, articles, webinars, books, and more, and use them to empower you and your patients to make a hugely impactful change for your health and the health of the planet. And, you know, we're all very comfortable talking about moving away from fossil fuels, and we're saying divest from companies that invest in these destructive industries. But at the same time, these big banks and industries also invest their money and resource into propping up the animal agriculture industry. So we must remember that without moving away from an animal-based food system, we will not be able to meet our climate and nature goals, even if we stopped using fossil fuels today. So once again, a huge congratulations to DAUK and your team, and I look forward to further collaborations.
Amazing. Thank you so much, Shireen. And if you haven't already been on the Plant-Based Health Professionals UK website, it's an immense resource. There are fact sheets for just about every health condition, and we've screenshotted a few of them and put them onto our website as well, just to give you a flavour of what's going on with it. And that's one thing that was really important to us as an organization when we were developing the website, that we didn't want to duplicate any of the work that's already been done, because there's no point. There's just no reason for that. And so we've tried to make organizations like Plant-Based Health Professionals, Greener Practice, and the others that have already done all of that groundwork, just give them a centralized platform that will lead to the likes of those organizations to be able to improve the web traffic through them as well. What I'll do is I'll ask Emma to talk next, and then Mark, and then we'll open it up for any questions to be able to chat. And then I think I've resolved the technical issues with regards to the Hugh Montgomery presentation. We'll have that just right at the end as the last thing, and then I'll stay on afterwards in case anyone had any further questions. So over to Emma, if she's there. And Emma, Dr. Emma Rush is a resident doctor with an interest. We actually met at a university course specifically on environment and human health. And Emma has contributed to, I believe, 3 of the sections on the website. She's got an interest in public health and preventative medicine. Over to you, Emma.
Thank you so much. And thank you, Dr. Kazam. That sounds like a really useful and interesting website, and I'm definitely going to take a look after this. So I've just been asked to give a bit of a background as to me and how I kind of got interested in this stuff and ended up here and involved in this. I think from when I was a medical student, similarly to Dr. Kazam, I was very interested in nutrition and kind of became very interested in the wider determinants of health, and it became very clear as I became a doctor and started working that there is so much more to health than what we were doing in hospital and what we're doing in GP, and there are just so many different factors impacting on people's health, and that's from things like smoking and alcohol, but all the way through to big things like climate change. And so I developed a real interest in public health and preventative medicine, and that's where I would like to take my career, and I would like to be able to have an impact on these wider determinants of health. And so that interest led me to discover the Environment and Human Health course at the University of Exeter, which, as Matt said, is where we came into contact. And I studied the postgraduate certificate last year, and it was just a really interesting course where I learned so much about some of these really broad determinants of health that aren't talked much about within the healthcare setting, like certain industries, air pollution, climate change, and in particular, I pretty much did a whole module on climate change and how that impacts on health. And it was fascinating, if not terrifying, to kind of discover so many different ways that climate change itself is impacting and is going to impact on the health of ourselves, the public, our patients, basically everyone. And it became very obvious that it's not just it's going to get hot and there's going to be more heat-related mortality and things like that. But it goes all the way through to it's going to change the salinity of seawater, and that's going to change ecosystems and people's food supplies and livelihoods. And it's extremely complex, and there are so many different ways that all of these factors interact and impact on our health. And so while I was studying this, and also while I was doing some research for admittedly a very small contribution to this project, I wrote a few of the healthcare professional specialty pages. While I was doing all of this, I read a lot of information, and lots of it was very specialized, very kind of complicated in lots of different resources. And it's very kind of, I had to do a real deep dive into the internet to kind of look at how diabetes and health and kind of healthcare all is going to interact to impact on people's health. And you know, unless people have a vested interest in this already, which I'm sure many of the people here today will, people aren't necessarily going to do that deep dive and find that information. And, you know, they might end up in finding very complicated research or complicated government publications that's just not easy to read, and it's difficult to understand. And you know, you might find one thing and you're not going to you don't have the time, that people don't have the time to be diving into this themselves unless they're already super interested in it. And so I think this resource is going to be a really amazing way to put all of that information into one place, into really like readable, user-friendly and compact resource. It's not just information, but it's also resources and you know, actionable ideas as to how people can make change within their healthcare departments, or you know, support patients and support each other to look after our own health in what is a rapidly changing environment. And so yeah, I hope that people will use it, and people who otherwise wouldn't go and do that research will be able to use that information to make change and, you know, look after themselves as the climate's changing.
Amazing. Thank you so much, Emma. And you've hit the nail on the head there, really, that there is so much information and it is such a deep dive that you end up in all sorts of specialties. I know you mentioned diabetes and endocrinology, and on the surface of it, it just feels like, oh, well, you know, it will be hotter and it will affect people. But the more you go into it, the more you learn actually there's information about increased risk of infection, increased risk of complications from diabetes due to these extreme weather events, and even simple things that you wouldn't typically think of, like insulin, one of the drugs that is essential for the care of diabetes, stops functioning above 35 degrees Celsius. So how are patients going to be able to store that in their homes if they're not equipped with that information? So exactly what you said, we've tried to summarize that. So thank you so much, Emma. And again, I just want to reiterate that along with Emma, so many people have contributed a lot of their spare time to this outside of the busy NHS work schedules and outside of all of their other extra commitments. The majority of contributors have been resident doctors, formerly known as junior doctors, who have all been pretty much on either full-time rotas or extremely stressed with work, and they found the time to do this because this is something that they really care about and are really passionate about. So we've please take a look at the About Us page just to acknowledge all of the people that have contributed to this so far. Mark, are you available?
I am. Yeah, no, thank you very much. Just
perfect. So lastly, Dr. Mark Harbour is a consultant nephrologist and associate professor at University College London. And he's also one of the advisors to the Royal College of Physicians on climate change and sustainable healthcare. Mark.
Matt, thank you very much. I should say also, Matt is also an advisor to the RCP on climate change and sustainable healthcare. But kind of modesty seems to be a thing here, because I could also say this is a fantastic. I mean, every time I look at the website, I'm in awe of it. So I think it's a huge congratulations. And like Shirin, my contribution is minuscule to this, but I think it's a really nice piece. I suppose really all I wanted to say was a kind of few philosophical points in a way. Having been interested, worried about climate change and so on and so forth, and I know you didn't hear Hugh's talk, which is a good thing if you want to sleep tonight, just because it is very stark and doesn't pull any punches, which is what it's designed to do. The state of climate change is dire. I mean, it's completely dire. Even if we stop producing every single greenhouse gas tomorrow and stop producing 8 atomic weapons worth of energy every second, we're going to get hotter. The floods, the heating, the changes that have all been kind of expounded up until now will carry on getting worse for a good while. So we're in real trouble. And I think there are certain ways you can respond to that. You can either become alcoholic or give up or ignore it. But I think from our perspective, if you take a kind of cold hard look at this as scientists in a way and medics, is that the climate change is absolutely a healthcare emergency. And I think it's really, really important that all of us repeatedly make that point. And for all the reasons that Matt and others have said, is that the health consequences of what's coming and what's already happened are extraordinary, and nothing we can deal with tablets, to be perfectly honest. So it is very, very important we do that. And there are a couple of elements that come with that. One is resilience. Well, resilience is kind of mitigation of the problem, but we haven't really thought about mitigation of that. So if you're in Pakistan 2 years ago and a third of the country is flooded, how do you run dialysis programs, cancer programs, and so on and so forth? If your servers melt down in St Thomas's, how do you deal with that? And so there are things that we definitely need to be thinking about in our own service and healthcare. How are we going to be prepared for that? But that is mitigation. And I suppose the other element to this, which has been touched upon, is that healthcare across the globe is 5% of greenhouse gases, so more than air industry at the moment, more than aviation. So we have a moral responsibility to reduce this. And the good news is that most of the things we want to do in terms of reducing our carbon footprint actually result in better patient care and are often much cheaper. So there's things that you'd have thought if you were a good manager you'd be doing anyway, and things as medics we should be doing anyway. So this is really, really super important. And it's important because it's quite likely that, for all the right reasons, that funding is going to move more from secondary and tertiary care to primary care. And even if that dial only moves a tiny, tiny bit, then that's going to move funding from secondary care. So anything we can do to save money would be a very good thing. And the other thing I would kind of say as a kind of philosophical point over time is, when I first started talking about this, I thought you'd say, well, this is what's coming, we should all change. And absolutely nothing happened. And I'm quite struck recently how there's been a complete failure to change, in fact, in many ways. And I'm sorry about the pinging, my computer's a bit upset. I'll try and ignore that. But if you go to a busy airport at the moment, you'll see that nothing's changed. You might get a recycled bottle of water, but that's about it. You'll see that some people might be buying electric cars, which is great, and that people are buying solar panels and so on and so forth. But in the big scheme of things, CO2 levels in the atmosphere are the highest they've ever been since the last 4 million years. Methane levels, similarly, for a very long time, and nitrogen dioxide. So although lots of good people are doing the right things, it's basically business as usual, generally speaking. Now, the good news is that that things are beginning to change. This whole boulder, this conversation that we're having today wouldn't have happened a few years ago. And I think what I've taken me far, far too long to learn is that this isn't a binary thing. It's a social movement. And that's what's so important. And Matt again alluded to this before, is that if you put solar panels on your house, your neighbour's 50% more likely to put solar panels on there. If you get an electric car, your colleagues might get, and the electric cars aren't perfect, but if you get an electric car, your colleagues are more likely to do that than buy a diesel SUV or something. So I think what I'm trying to say is that we're in a really grim situation, but things are lined up to change, and the new government in the UK seems very keen on prevention. And the truth of the matter is that we know exactly what's required to have a healthy population. It's clean air, clean water, good education, good maternity, good food, plant-based diets, lots and lots of exercise, and so on and so forth, much of which has been missing, and particularly in socioeconomically deprived groups and so on. So actually, if the government's going to go for that, we as a healthcare community need to really, really push. In fact, we need to be leading the charge and saying this is what matters. And it's a 30-year plan, but it's the way to deliver good health as opposed to treating illness. So that's really important, and that's something I think we should get behind. And if we have a government that's interested and needs our support, then we should do that. And the co-benefits are enormous. I mean, they've been alluded to a lot before. So I think, I'm sure Ciaran will correct me, but I think if the country moves to a plant-based diet tomorrow, we save about 17,000 lives. And it's not just the lives we save, it's people turning up and having treatment for bowel cancer and heart attacks and so on and so forth, which is a much larger number. So there are extraordinary things that we can do that make a really big difference for healthcare, for finances, and so on and so forth. And I think that's the trick now, is how do we go from numbers of people doing small things and people in healthcare bashing their heads against a brick wall trying to get managers who are ground down by pandemic and 14 years of underfunding to make these changes. And I think that the answer to that is there is a real appetite in government to do the right thing because we can't carry on doing what we're currently doing. And secondly, there's a huge potential for everyone in healthcare, again, as Matt alluded to champion change. And we're the ones with college educations, and we're the ones who should be saying, I'm doing this, we can all do this, with huge benefits. And so it's an exciting moment. And I think the trick is for us all to kind of really get involved in doing this and championing it now. And I don't mean to embarrass you, Matt and co, but it's a really, really nice bit of kit that people who are just starting out in this and don't really know where to go with it, but a concern can go. So a really huge applause to you for doing this. And I would urge anyone who's on this call who isn't champing at the bit to go for it, because now's the time to change your energy provider, change your bank, and start making other people do the same.
Amazing. Thank you so much, Mark. And so much of that, I think, resonates with definitely all of the panelists, and I would imagine a lot of the attendees as well. There's some nice comments that are coming in already. Does anyone have any questions? I'm conscious of time, and I do think I've got Hugh's talk working. So what I'll do, I'll play that at the very, very end so that anyone that doesn't want a full night's sleep, as Mark said, can carry on and watch that. And then I'll be at the end. I'll just hang on to answer any questions that come off that at the end as well. But before we do that, I'll do a couple of closing words as well. And does anyone have any questions for either Emma, Mark, or Shireen? Either pop them in the chat or raise your hand, and now's the time, and then we can unmute you, and that would be the time to ask. Going once, going twice. Okay, so in that case, what I would just very much like to do is say firstly, a very big thank you once again to all of the people that have contributed to this resource. Their names are all on the About Us page. I won't read them out because I will have probably missed someone off it, and that's just not fair on them. but please go and check it out. The site is being supported now by the Centre for Sustainable Healthcare, the UK Health Alliance on Climate Change, EcoMedics, Green Health Wales, Real Zero, Greener Practice, the Society for Acute Medicine, SEE Sustainability, Plant-Based Health Professionals UK, and it's very likely that others will be following. On social media, we've already had a really good amount of traction. We've had Chris Packham share some of our work. We've had a number of other sorts of people and organisation share the resource as well. And so I guess I just want to finish this side of things just once again with just sharing my screen on this poster. Now, Mark alluded to the fact that we need to be doing things, and there's a real social movement in order to be able to make the changes that are necessary in order to secure a livable future. What that is going to look like, people have spoken for quite some time about doing a public health campaign on climate change. And there's a growing campaign in some circles to try and encourage the government to do so. There's certain governments that are already taking a decent amount of action to use the health service, use the NHS to drive climate action and to drive this conversation. So why should we wait? That's my question. Why do we need to wait for the institutions in power to make these changes, to wait for another however many years whilst the temperatures continue to rise? We don't. We have the power. We can take action ourselves. And this is where you come in. This is where we come in as a community of people that want that livable future, but not just want the livable future, but all of the beauty and the wonder that comes with the rewilding process of reclaiming our wildflower meadows, of walking down avenues filled with fruit trees, of reducing that poverty, that air pollution, that improving that water quality, having rivers that we can swim in. That's what we want to work towards. That's what we want to aim towards. And we need to be the ones to start driving that conversation. So distribution was something that was really important when designing this resource, because what's the point in having an excellent resource that no one sees? And the QR code poster is the idea that we have. The QR code poster, there's a black and white version and there's a color version, and it's downloadable by absolutely anyone. And what we want you to do is we want you to reach out to your local health services. We want you to get in touch with the likes of your patient participation groups. Maybe you're a health worker and you work in various departments. Maybe you're a patient that doesn't really know what they can do about this, but has a good relationship with their GP. Tell them about this. Print off a poster and take it to them. The carbon, just to reassure you all, the carbon of printing off that poster is far, far outweighed by the savings that will come from 5 people seeing that and one of those people changing their bank accounts. That will make it all worthwhile. So let's get this resource shared. Let's get those conversations about climate change happening. Let's use those 1.6 million health workers and those 600 million healthcare interactions to talk about climate change and to talk about how we can make a difference. These posters have been live today. We already have evidence that they've been printed off in some departments, in some emergency departments, and they've been stuck up in their sort of educational centres, but also there's no reason why you can't stick them up in a waiting room, provided that everyone's happy with that in your department. And if they're not happy with it, then you need to explore really why, because a poster is a poster that helps with climate change education. The whole of the NHS has environmental sustainability governance policies that it needs to adhere to, and climate education is one of them. So let's have this conversation and let's make that public health campaign together so that collectively we can be the public health campaign, we can make the difference. And the only reason why all of us have contributed to this is because we genuinely believe that we can make a difference. So please get involved, please share it. And if anyone's got any questions, please let us know and drop them in the chat or follow up afterwards. Thank you. And any questions coming up at all? Lucy, I don't know if you're still with us.
Still here.
Have
I
any
think I was
questions?
just applauding you for all your hard work, actually. Really inspiring. Thanks so much. You're just getting a lot of compliments here.
Oh,
Excellent resource, brilliant, very informative. That's what people are saying. Great work, Nat, and everyone. Yeah.
and that really means a lot because I don't know how many hundreds of hours I've spent on this and sleepless nights I've already had making sure that this is functional for today. It really wouldn't have been possible without the support of DAUK. It really wouldn't have been possible without the support of everyone that has contributed to this, and also friends, family, my partner, my mum, everyone who has sort of supported this development going forwards. So, okay, without getting too sentimental and whatnot, let's hold on to that thought of how we can be the public health campaign. Let's drive it together and we can really make a difference. There's one question that has just popped up now. Are there ways we can suggest other resources, impactful actions? And is there any hope to add a section on procurement and or working with estates and facilities? There is a section on facilities, and that includes estates there. And there's also one for management and executives with a nice little plea to managers at the bottom. But all of this has, every paragraph is linked to another resource. So the potential for exploring all of the realms of climate change and health, it's all there and it's all available. I don't know how many resources there are. I think I've lost count. Probably over 100 different resources to signpost to. So signpost to this one in the first place, and then you can go from there. There's another question about how do we get copies of the poster. The poster can be downloaded off the homepage. It's the first thing that you see. There are two buttons that say download a color poster or download a black and white poster, and it's that simple. Just click on those. Okay, I'm conscious of time. If anyone does have any other questions, please email contact@dauk.org. Doctors Association UK is an independent non-profit organisation run by volunteer doctors and medical students, and they are hosting a conference next May the 17th.
Yeah, that's right.
Which we will be having a climate change panel on that conference, and the theme of the conference, it will be a memorial conference in memory of Dr. Jenny Vaughan, who was a prominent Doctors Association UK member and passionate campaigner about injustices in healthcare. So it'll be a really great event. So check that out on our website as well. Right, I'm clearly losing my voice, so I'm gonna attempt to hand over one last time to Professor Hugh Montgomery, who is going to introduce himself. I will pop back on the call at the very end once the talk has finished. And again, just a little reminder, if you want to have a sleepless night, have a watch. If this has been enough and you're feeling inspired already and you can make a difference, then feel free to disappear and send on the poster to everyone in your WhatsApp contacts. Excellent. Over to Professor Hugh Montgomery. Fingers crossed, everyone. And Lucy, can you let me know if it works?
Yeah, will do.
Well, hello, my name is Hugh Montgomery.
Yeah,
I'm
it's
Professor of Intensive
working.
Care Medicine at UCL, but I also chair the Lancet Countdown on health and climate change with a colleague. I'm going to briefly tell you about the threat that climate change poses, the immediacy and gravity of it, and what we need to do, because it is almost certainly getting close to being too late, but we must act now, and we must act aggressively. We've been warned, of course, for at least 165 years of the threat that greenhouse gases pose. John Tyndall here 165 years ago warning us that carbon dioxide as a greenhouse gas lets shortwave radiation through, but traps longwave radiation. And he said industrialization and rising CO2 concentrations threatened the planet. But we took no notice. And we've had multiple warnings in the last 50 years, which we've ignored, until these from the Intergovernmental Panel on Climate Change 2 years ago, which said that there is no time for further delay. Unless there's immediate concerted global action, we miss a brief and rapidly closing window to secure a livable future. That's one where you or your children, if you have them or would choose to, could survive. But we've done nothing. There's John Tyndall's warning back in 1850 when greenhouse gas emissions were relatively low. But look how they've increased. Land use in green, but fossil fuel burning there in red. We've ignored warnings from Henry Kissinger, the Toronto conferences in the late 80s, the Conference of the Parties negotiations since they first began. And indeed, we're now releasing around 53.8 billion, that's 1,000 million tons. Each ton is 1,000 kilograms. Each kilogram is 520 litres of CO2. That's what we're releasing now every year. And a fifth of that will still be boiling our planet in 33,000 years, and 7% boiling our planet in 100,000 years. So if we don't stop now, it will become irreversible. And atmospheric concentrations, of course, are rising, but we're increasing the amount of CO2 we release, and concentrations are therefore rising at an ever-increasing rate, trapping a huge amount of energy. How much? Well, somewhere around 8 Hiroshima bombs worth of energy every single second. This is causing temperatures to rise. If we look at, this is actually average land, global surface temperatures. These are land surface temperatures over Europe, and these are Arctic temperatures. So whilst we're looking at average temperatures rising globally, those over land, those over Europe, and those particularly over the Arctic are rising very steeply here in the Arctic already by 3 Celsius above pre-industrial levels. And you can see this in a January to December cycle, each wiggly line being a year, every year getting hotter and hotter. The orange line is last year, this massive departure from previously, which hasn't settled, because this year, up till August there, is the red line. In fact, June of this year marked the 12th month global temperatures were above 1.5 degrees, and that's actually continued now in July and August. So we're now 14 months in. Sea surface temperatures are rising. Here they are again, each wiggly line a year, each wiggly line getting hotter, orange line being last year, the black line being this year, this sudden acceleration in temperatures, which we will explain later. And actually, again, it's not similarly geographically distributed. Some areas there are 3 to 4 Celsius above average, and some areas there, for instance, the Baltic last year, was 11 Celsius above normal as a surface temperature. And the Mediterranean Sea this year reached its highest surface temperature ever recorded. This heating extends down to a depth of 2 kilometers. This is energy accumulation each year in zetajoules. Hard to know what a zetajoule is, so I've converted it to something you'll understand. The energy gain to the oceans last year was enough to take 1 trillion swimming pools from 0 Celsius, that's freezing point, to boiling them. This is causing average Arctic sea ice extent to reduce. It's causing Antarctic sea ice extent to reduce. We're losing ice in the oceans and on land. We're seeing a huge amount of loss from the Greenland ice shelf, over 5,000 square kilometres since 1985. And we're currently losing this vast quantity of ice. I just moved myself out of the way there. 30 million tonnes of ice an hour currently just from that ice shelf alone. This was Switzerland. This is just one representative glacier in 1980 and now. Swiss glaciers lost 10% of their volume in 2 years up till last summer. And if you melt land ice into oceans and you thermally expand those oceans, sea levels will rise, and they are also at an accelerating rate, now 1 centimetre every 2 years and accelerating. Remember, the last time we breached 420 parts per million of CO2, sea levels were 58 metres higher, and we're currently at 427 parts per million. If you add energy to an atmosphere, you get weather. The more energy you add, the more extreme weather events you get, and the more extreme there are. And I won't run you through the last 5, 6, 7 years worth of data, because you remember every year getting more and more extreme weather events around the world, and these are accelerating. But just to remind us, because I'm going to come back to it later, of the Canadian fires of 2023, which of course we've had more of this year, but these were the pictures in New York as the smoke drifted south. This year alone, let's just remind ourselves, huge temperatures in Chile, 33 Celsius, normally 21. Massive landslides in Los Angeles County in California, Swiss ski resorts without water, Catalonian reservoirs down to 16% of their normal volume, and that was in the winter. Texas having its second biggest fire ever. Dubai flooding, having 2 years of rainfall in 18 hours, and that was followed by that repeating only a couple of weeks later. Millions at risk of floods, in fact affected by floods in China in April. In June, these massive heat waves in India causing 40,000 cases of heat stroke. Record temperatures sweeping the United States in June. The Hajj pilgrimage actually killing 1,300 people in Saudi Arabia with these record temperatures. Extreme weather events savaging Europe in June and July, and these massive fires in New Mexico as well, along with massive Arctic wildfires now tearing through Russia, releasing huge quantities of methane and CO2 from fires. We know, though, that these sorts of effects threaten us directly for reasons I'll explain, but they also threaten our ecosystems. If we continue as we are, as this paper in Nature says, Science says, we are leading to a mass extinction to rival those of Earth's past in coming decades. All of this with a global 10-year rolling average surface temperature of 1.43 Celsius above pre-industrial. This is clearly catastrophically dangerous. We have to get that back down, and we have to stop it rising further. And yet we're doing nothing at all. This is what we burned last year around the globe. And that isn't getting any less. We burn more every single year. And worse than this, we've triggered at least 10 positive feedback loops. As we melt surface ice, we reflect less heat and light back into space, the surface albedo effect. The melting of ice has meant that the Earth's energy gain has doubled in only the 14 years in terms of its rate. In addition, surface slush is now known to have appeared. And of course, the slush on the surface of that ice absorbs heat as well. So again, we've massively underestimated this loss of albedo effect. These data are only published this year. The fires are releasing carbon dioxide, which is itself a greenhouse gas. How much? Well, let's just think of last year's summer fires in Canada. They added 6% to global anthropogenic greenhouse gas emissions on their own. And they weren't the only fires in the world either. Those fires also released carbon monoxide, which mops up hydroxyl radicals. Hydroxyl radicals would clear methane. Methane is 83 times as powerful a greenhouse gas as is CO2. And it's also being released from melting clathrates and hydrates in soil, frozen tundra, and carbonate rocks. It's being released from melting wetlands, fermenting wetlands, and released from melting stores in the Arctic. We also know that trees have a microbiome that absorbs methane. And as we're losing trees to fire and deforestation, that is also causing methane concentrations to rise. And we can see this here. This is methane, which is rebranded as natural gas, but natural gas is largely methane. concentrations going up largely from leak from gas fields and from coal fields, reaching an equilibrium, which has now started accelerating away from us because we're releasing more methane and we're no longer absorbing it. The storms from evaporation from the seas are injecting water vapor 19 kilometers up, where it acts as a greenhouse gas. We are emitting massive fires, and indeed the rainforests are now net emitters of CO2. We're warming the tundra, which means it's fermenting and it's also respiring, releasing more CO2. Worse still than this, though, weather states will change in a binary fashion, and they are. Rapid warming of the Arctic and Antarctic occurs with climate change. And indeed, the Arctic is warming 4 times faster than the global average. That can rapidly accelerate in what are known as Dansgaard Oskler events. And this paper in Nature from 2 years ago suggested to the right there that we triggered a DO event where temperatures might rise very, very quickly indeed by around 32 Celsius in the Arctic. The worrying thing is that we seem to have done that. This was March the 21st last year, when temperatures in the Antarctic were 40 Celsius above normal. In the Arctic, 30 Celsius above normal. The following day, Antarctic temperatures were 47 Celsius above normal. In June of that year, average temperature in the Arctic Circle were 32, that's plus 32.5 compared to a normal of 13. And we're seeing very rapid and unstable spikes in temperature, these in Greenland in 2023. The 3rd year in a row, we had this massive acceleration and leading to huge volumes of ice melt. Around 7 to 8% of the annual ice melt happening in just one weekend. The ocean currents, this being one of them, the Atlantic Meridional Overturn circulation, are critical for distribution of heat from our oceans around the globe. We now know that we're close to a point of critical transition as that slows and collapses. That's going to lead to catastrophic weather change around the globe. The jet stream, which is a high altitude, fast-moving river of moist air, between the cold Arctic air and the warmer southern air, is of course moving north because the Arctic air is warming more quickly. That is going to produce and is producing massive droughts in Spain and Portugal, hence those low reservoirs we spoke of earlier, but they're dumping rain in northern Europe, hence the very wet winters we're now getting, which lost 10% of British agricultural product from the land this year alone. And this is all going to affect humans. We know that at least 18% of the world's surface area currently occupied by humans will be uninhabitable, displacing or killing more than 3 billion people, with 2/3 of a billion moving because they'd be under the high tide mark. That's half the world's population. They'll also move, though, quickly because of economic collapse. Extreme weather events are now causing the world economy to lose over $4,500 a second. We've lost 4.3 trillion in recent years from the world economy alone, and Lloyd's of London warn that we're likely to lose 5 trillion from the world economy in the coming few years. There's a 1 in 300 chance of just a single extreme weather event in just one country in just 1 week, causing the world economy to lose nearly 1/5 of its value, $17.6 trillion in a week. That's the end of the world economy as we know it. It's going to get worse, though. We know that we are committed to a minimum loss of 1/5 of the world's economy within 25 years. And we could lose 38 trillion per year in the global economy within the next 30 years. And that's the next 25, in fact. That's 1/3 of the global economy. So no jobs, no food, no health system. The Institute and Faculty of Actuaries and Insurers last year indeed warned that without immediate transformative action, our economy may not exist at all. And they say that we've left it too late for incremental change. We need transformational change. And we've far less time than we thought. This paper in Nature from earlier in this year showing that we're going to get 2 Celsius of projected warming by the late 2020s. So it's catastrophic. Your life and mine are threatened. We must act. Is it too late? Not quite, but it will be if we don't act immediately. We have to get on and act now. We have to commit. You, right now, and I must commit to acting. Not think about it, not suggest that we'll think about it a bit down the line, but do. We need to act now. We need to lead others to do it. We need to do it at once. I'm going to leave you with this. You can photograph it. I'll put it up now for a while, and you can take a camera and photograph it. The immediate actions that you must take today, not tomorrow, not think about doing, but you must take today. You must move your money to a bank that does not invest in fossil fuels. All of the major high street banks do. So move to the Cooperative Bank, the Nationwide Building Society, Triodos, or Monzo. Those are the banks that do not invest in fossil fuels. Move your energy supplier to a 100% renewable supplier. That might be Good Energy, it might be Octopus Energy, for instance. There are others, but Octopus is the leading customer service brand, and I'm with Good Energy and they're excellent. You must move to a plant-based, seasonal diet. It's not to say you must never eat meat, but you must cut right back on it, because local seasonable foods have low refrigeration, don't use fossil fuels to heat greenhouses, for instance, and have low transport costs. And plant-based foods save a huge amount of methane from belching cows, and also rainforest destruction for their grazing and the production of soya. Try not to travel. If you do, walk and cycle. If you have to travel further distances, use trains. And please try not to fly if you can possibly avoid it. Try to buy less, buy local, and look at what you're buying and the brands. Measure your carbon footprint too, to look at what else you can do. There are simple things, for instance, every degree that you turn your heating down in the winter will save 7 to 11% in your emissions. So extra jumpers down by 4 degrees, you can halve your CO2 footprint from heating. But there are footprint calculators online that you can use. And finally, let's get an R number up. An R of 3 and a bit for COVID meant that the 10th cycle of infection infected nearly 90,000 people. We're told that each one of you has at least 7 people who knows you or loves you enough to take action if you ask them to. And if you get those 7 people to act, and each of them gets 7 people to act, by the 10th cycle, more than twice the total population of the planet has changed their behaviors in only 10 cycles. So we can do this, but you must just find those 7 people and make sure they act. Because, as David Barry says, we can be heroes forever and ever if we act. What do you say? You can be those heroes. Thank you for listening. We have a non-profit organisation if you want to engage with us to try to drive down emissions. And here's our website. Thank you for listening.
And it looks like in the group still, there's going to be 22 people who won't be sleeping tonight. That's Professor Hugh Montgomery, as ever, giving an excellent climate talk. He would have been here in person, but wasn't able to do so. If anyone has any questions, then now's the time to have a chat. Otherwise, feel free to, like I say, drop as an email or contact@dauk.org. There is also a feedback form on the website itself in case you have any ideas. It's just a little banner at the bottom that says, how can we improve? Feel free to drop any ideas there. And otherwise, I wish you all a very happy night, and thank you so much for attending today again. Please share far and wide on social media with all of your healthcare contacts, and together we can do this. We really can do this, and I'm excited that we can do this together. Thank you.